my patient JJ, and today we're going to be rehabbing his torn ACL. First exercise we're going to do today is called a quad set. And with a quad set, what you're going to do, you're going to constrict the quad muscle and push the kneecap down towards the table. So we're going to get him started on 15 of those. The reason we push the kneecap down towards the table is because when you tear an ACL with all the swelling and everything, your range of motion really gets messed up. And if you don't really work out that area particularly, you're going to lose that range of motion for life. Good. And you did a good job right there of really holding in that compression to really start to get that muscle working again. Our next exercise that we're going to do with JJ is going to be straight leg raises. To do a straight leg raise, what you're going to do, you're going to compress the quad once again, push down the knee, and then lift the leg at the hip. And since JJ's an advanced patient of ours, we're going to add an ankle weight to him. And what size ankle weight all depends on how advanced your patient is. So if you could go ahead and give me 15 of those. Hold on. One thing you really need to do when you're doing these exercises is control your leg all the way up and down. It really helps out your muscles a lot. So we're going to start back over and give him 15. There you go. The reason we're working a lot on this quad is because when you tear an ACL, it constricts your blood flow to your quad, and it makes it go into shock, and it just turns to mush, so you really need to get that muscle back right. $15 of them? Good. Our next exercise that we're going to do is going to be seated leg raises. So once again, I'm going to attach the ankle weight. And he's going to scoot to the edge of the table where his legs hanging freely. And he's just going to lift the leg up at the hip. Like that. Good. Give him 15 of those. That exercise is really working out the hip flexors, and it's good to do the hip flexors because your quad is one of the muscles that control your hip flexors. This can also help with your range of motion to get it moving back and forth. Good. While he's in this position, we're also going to get him to do leg extensions. To do a leg extension, do the same thing and just extend the leg forward. And when you get to the top right here, make sure you really constrict that quad, get a good extra push. Right here he's getting a good extension, really getting that range of motion back, so he's doing a good job of it and holding up at the top. Next major muscle group we're going to work on is the hamstring. So we can get JJ to lie down on his stomach. We can stick this towel underneath his leg to help him get that good flexion. You got another ankle weight, and we're going to do hamstring curls. So with a hamstring curl, just pick the leg up, really tighten it up right at the end, and slowly bring it back down. So we can get him to 15 of those. Go ahead. Good. The reason we really work on the hamstring is when you tear your ACL is what keeps your leg from going back and forth like this, and hamstring. If you get that muscle really worked out, it can really help out with that to pick up the slack in the ACL. And also, most ACL surgeries, they use a hamstring graft, so it's really good to have a nice sized hamstring for them to take. Did a good job with that. Really got some good extension right here, so you can really help out with that range of motion.
Gravity is working against me. And gravity.
Next exercise we're going to have JJ do is going to be a standing leg raise. So we're going to get him off the table. You're going to stand by me. We're going to attach your weight to his ankle. Turn side so you can see what you're doing. What we get him to do, lift his leg up, hold it, slowly bring it back down. So give him 15 of those. Try not to move your leg, just use all, there you go. Only knees. Good, really work out that hamstring. Slow up, slow down. Really get a good hold, real tight at the top. You can get a lot of stability from doing all these hamstring exercises. It's going to really help out to get back on the field. Good, 15 of them. Good job. Try to stretch out that hamstring, get a good range of motion back. So you're going to get him back on the table. Let your leg hang off. Get the towel underneath. Attach your weight, give gravity some extra power. And under normal clinical circumstances, we would let him do this for about 5 minutes, turn the lights off, let him relax. But since this is just a demonstration, just want to show you how it's done. We let him sit here, just let him chill out, and just come back, check on him about 5 minutes. Next thing we're going to do is to help out the quad stretch. Take this towel back. We're going to get this elastic band right here. This TheraBand, we're going to attach it to his foot. And we're going to get him to hold on to it. Since I don't know how he's feeling, we're going to let him do it, pull until he feels it, and just let him hold it. So give him a hold for 15 seconds, then relax, then hold, then relax. The stretch is really good for him because even though you don't think about it, stretching really does build up your muscles too. Good. Relax for a little while, let the blood get back to it. And we'll pull on it again. And some people, they don't like to go all the way with that therapy, so you might have to give them a little bit extra. Good job. So, if you ever need to rehab an ACL, that's how you do it. Thank y'all for watching, and JJ, good luck.